Major changes to the overall healthcare system are on the horizon. Starting in 2014, the new healthcare reform bill, which was passed into law by President Barack Obama, will require improvements in the way health information data is shared, as well as changes in the overall quality of care, efficiency, and costs.
There are some regulations which require all providers, meaning doctors and hospitals, to engage the patient. And if they don't engage a certain percentage of the patients, they will no longer receive the full amount of reimbursement from Medicare. So if you follow the money, basically what that means is the federal government is not going to pay unless the providers engage the patient. And because Medicare generates about 40 to 50% of the average hospital's revenue base, they're all going to do it. And same with the physicians. Many physicians have a large population of Medicare patients, and Medicare will no longer reimburse them at the full amount unless they automate their records and engage the patient and make those records and information available to the patient, which currently is not really there. Most of your information is paper-based, and you have to go to this provider and this provider and this provider to get your information. And what the government is trying to do is make that information what they say liquidity, data liquidity, so that you can have your data wherever you need it, whenever you need it, so that you can get proper care.
Manfred Sternberg, president and CEO of iHealth Trust, created a nonprofit organization to accommodate these new mandates.
So we created a third-party, nonprofit, non-stakeholder institution called the iHealth Trust, which is a 501c3 nonprofit, and we have no shareholders. The community is our group that we answer to. And what we are attempting to be is that third-party, nonprofit, non-stakeholder group where you can trust your information because it's your information. It belongs to the consumer. It does not belong to the hospitals or the doctors or the insurance companies or the government. It belongs to the consumer. And then the consumer can own and control their information.
By having the Texas Medical Center in Houston's backyard, it allows the consumer patient to make their own choices on medical care.
At the core, healthcare is an information-based business. Information has always been the best clinical tool for the physician or any provider. Information and knowledge are always the best clinical tools, and what they don't have is they don't have the information and they don't have the knowledge that they could have using technology, information technology, as we see in every part of our other part of our lives, that they realize that if they had that information and they had that knowledge available at the point of care, we could treat the patient better, faster, cheaper, with better outcomes.
Perhaps the best analogy to describe this whole process is comparing it to an airport.
If you think about the efficiencies that could be created, let's go back to the airport and look at the kiosks that now have become prevalent in every airport. You use that kiosk not because the government compelled you to use that kiosk. You use that kiosk for your own convenience, what we call a legitimate selfish reason. You want to get on the plane easily, safely, and you can go through security by using the kiosk, so it's a secure way of identifying you, the airline traveler. Much like that, we want to do that in healthcare. And if you think about it, all we did was get rid of ticket agents. We did not get rid of pilots, and we did not get rid of mechanics. We got rid of overhead. We made it more efficient. And in fact, some airlines will allow you to print your boarding pass at night using your paper and your ink, and they'll give you a better seat. Well, the government wasn't involved in that, and the consumer was engaged and was not really pushed to do the kiosk. They figured that out themselves because there was a convenience. And so you still do not have to use the kiosk if you choose not to. You can still go to the end of the counter and talk to the gentleman or the lady at the end of the counter and get your ticket. But the vast majority of people want the convenience of getting on the airplane by using the kiosk or by printing their boarding pass the night before. That's what we want to do in healthcare. That requires the community to say, this is the way we're going to identify people. This is the way we're going to identify physicians. This is the way we're going to identify healthcare workers. Because all of those people are going to be accessing this information system. And so who's going to be in charge of that identity? Well, again, we don't want the government to be in charge of it. We don't want the insurance companies to be in charge of it because we don't trust them, with good reason. And the hospitals can't agree as to who's going to be in charge of it. So that's why we created a third-party nonprofit to be in charge of identity with one fiduciary duty, and that is to the consumer, not to disclose your information without your authorization, period, end of story.
The mission of iHealth Trust is to position Houston as one of the leaders in healthcare and to also serve as a pilot program which may be used as a model for the rest of the country.
You have a much more educated populace than you've ever had before, and the doctors, as good as they are, cannot know the breadth of the information that's out there. So by using the patient in a new way to help deliver care, that will transform healthcare.
In 2007, Governor Rick Perry appointed Sternberg as the chairman of the Texas Health Services Authority.
I believe that the consumer has a very active role in healthcare, and in this next 10 years, the consumer is going to show up in the healthcare system like never before, and they are the most underutilized resource in healthcare, the consumer, because no one cares about your healthcare more than you do. And if we can engage the consumer into helping the healthcare industry treat the consumer, we will lower the cost because it's an asset that we've never really used.